Hey there, I'm Dr. Brian McKay from Core Health in Darien. And one of the biggest questions I get is, will my back pain go away? Yes, for the most part, your back pain will go away. And actually, during our intake, if I don't think I can help you, the first thing I will tell you is that, and we won't take your case on. So, with that, having said that, what I want to get into here is people with bad backs think that the back, when it doesn't hurt them, there is no problem. So they don't care for it. Let me ask you a question. Do you brush your teeth every day, hopefully twice a day? Why? Does your teeth hurt? No, but you still brush your teeth. You're taking care of it. People sit down an awful lot these days, a whole lot, more often than we should be sitting, but that's the nature of society, and we're stuck with it. So can't change that. What I can tell you, though, is your back is mechanical. There is no mechanical thing that is static. What I mean by that is that's dynamic. The back is dynamic. You have mechanical elements, and they are going to be subject to breaking down. Why do you think 4 out of 5 people have a back pain? The reason they have back pain is because when we sit down, 2, we're not exercising, 3, we're overweight, 4, there's poor nutrition, and it can go on and on and on. But those are the 4 main reasons people can have back problems. But also, too, is we're living longer and sitting an awful lot more than we should. So, how do you get around it? Well, if you're really going to take care of your back, you're going to be a regular exerciser, and it doesn't preclude you from getting a bad back. I mean, you could be a really fit golfer and you take a swing the wrong way. You're subject to traumas, just like you can take really good care of your car and still get into an accident, and these things happen. So if we just kind of realize that just because you don't have pain in your back, it doesn't mean your back is bad is healthy. It doesn't mean the back is bad. It means the back is not painful. So usually when we get a little pain in the back, that's when we start to act. At that point, listen, when it's a low grade muscle strain, you take it easy for a few days. You take some Advil, Aleve, Tylenol if that's your thing. You rest it up, you heat it up, you do some light stretches, and the back pain's going to go away. That's if you have a lower level problem. Now, what happens if it comes back in 2 or 3 weeks? And then you're dealing with it again. Well, you have a little more serious bit of a problem. But now you do the same thing and get the pain to go away. What I'm trying to get you to realize is you have a structural issue, and at times it's going to bother you, just like a toothache. You can have a toothache one day and have no pain the next day. Is your toothache healed? No. So the body really tells you when something's wrong. It's up to you to interpret these signals and really figure out what it is you want to do to treat it. And okay, I'm a chiropractor. We have a physical therapist on staff, matter of fact, a great physical therapist on staff, and we each serve a purpose. I mean, I'll be honest with you. Some of the earlier cases of back issue, where really the vertebra is not misaligned and out of place, because that's what I come in to fix, is that physical therapy would be wonderful. But people aren't going to go to a physical therapist initially. They're going to go to the doctor, their MD, and he says, "Oh, yeah, take these pills. These muscle relaxes. The pain goes away," and the pain will go away. However, the problem will not get solved. So it's a matter of taking it one step further. How do you want to treat it? I mean, the oil light comes on in your car. Do you say, "Oh well," and you can keep driving, but now after a while you start to risk it. So do you keep taking the Advil, keep ignoring the early warning light on your dashboard? That's entirely up to you. But understand, at some point in time, you're going to pay the price. And when you pay that price, it's usually going to be a lot more expensive than if you didn't just take care of it at the beginning. And that's true with anything. So as I was just getting started saying, is the physical therapy is wonderful. Your body, you get in the beginning, you have a little backache, especially due from muscle strain. If you have a that type of back problem, physical therapy is wonderful, and you probably leave there with, a good physical therapist is going to leave you off with certain exercises which you need to be doing. Those exercises are important. Have at it. So, what I'd like to say is back problems are a little more complicated if the pain keeps coming back. If you keep treating it the same way and it keeps coming back, your treatment, maybe the heat, rest, ice, stretching, Advil, or leave, is no longer effective. And but the pain again will come and the pain will go. The underlying problem doesn't go away. And that's where a good chiropractor and a good physical therapist, especially, and maybe it sounds like a shameless plug for what we do, but you listen to this, may not even be within our drawing area. We serve Darien, Norwalk, New Canaan, and Stanford. So you're really not in our drawing area anyhow. But the idea is, if you got a back pain and it's been there for a couple of months and it's off and on, and maybe it's not so bad, go to the chiropractor now when it's really, really a lot less expensive. Okay, that's the key thing is you take care of it. Now, if you let that bad back pain turn into a herniated disc, a bulging disc, or stenosis, you're talking about a lot more care and also a lot more money. Who wants to drop that? And a lot more pain and discomfort, a lot more time in the doctor's office. So, a good offense is best offense is a good defense, right? You get to the gym, start doing some stretching, get some blood flow back there. Sitting down, there's like over three times the pressure on your discs when you're sitting down from when you're standing up. So, or if you're sitting down all day, get your butt up and walk around. Go out, go for a stroll, go to the water cooler, hydrate. Water is very important. Water is very important, but also too, getting back to the movement is essential because there's no direct blood supply to the discs in the back and the spine. But as you move, that's how fluids disperse and lubricate the joint. So you want to be around moving this thing around, so you do have a better lubrication in the joints. Which better lubrication, less inflammation, especially those nerve roots. So I think if you just take a common sense approach, consider your body like a car. Do you change the oil, rotate the tires, take it in for regular servicing? Well, if you do that, chances are you're going to be fine. Doesn't mean you can't go drive out of the mechanic shop or just for preventative maintenance and have an accident. You probably will have an accident at some point in time. It's just a fact of life, and so that's why people with healthy backs can have issues. You can, you're a golfer and you hit a root, or you take a swing and it goes awry. Whatever. You're a tennis player and you start to get tightness up in the neck and the shoulder into your elbow. The more you use something, the more there's a greater proclivity something's going wrong. But you cannot choose to ignore the structural aspects of the body and the spine and the role it plays in keeping you pain-free. And if you were just to be a little more cognizant of it, just put in the same term. You can't replace your spine, right? You can go nowadays. You go and get a new tooth. That's been shown, been pretty successful. What we got to think about doing is how do we actually get you to wake up, do some stretching, do some exercise, get moving, try to work on that core a little bit. And these are all little steps that you can take to make your back better. And I think everybody's well aware of it. Gentle stretches. Just get off the couch, get away from your desk, get out of your car, move around, movement, okay? Because primarily, I don't know if you know this, arthritis is primarily lack of mobility, which leads to pain and wearing away the joint. And listen, let's try to stay as young as possible, especially in this day and age. So if you have any questions, you can always reach out. My office number is 203-656-3636. 203-656-3636. I'm Dr. Brian McKay. I'm a chiropractor right here in Darien at Core Health Darien. And you got a question, shoot us a question. But back pain, we do a pretty good job of fixing it. But the question is, are you going to do a pretty good job of keeping it fixed? It's not like I can't, you get your car out of the shop after having an accident, and then all of a sudden I give you the keys back and you go out and have another accident. Well, whose fault is that? It's no one's fault. It just happens. So I'd like to encourage you to take better care of yourself. Utilize a chiropractor for back. And again, I honestly think if you go to a physical therapist when you first start getting these aches and pains, you're going to do a lot better job because you're going to be stretching properly, getting the right therapy, because therapy is important. It's chiropractic to unsolve all back problems. But I can tell you one thing, if you do chiropractic with physical therapy, as we practice it here at Core Health Darien, you're going to be doing a heck of a lot better. I mean, a whole heck of a lot better. And the idea is to keep yourself mobile and pain-free and active. So I'm Dr. Brian McKay. I'm going to sign off now. Keeping you pain-free and active is really, it's my mission today. All right, you have a good day. If you have any questions, give us a call, 203-656-3636. Thank you very much for listening. I hope you learned something.